Graham Elementary is located within Cleveland County in Shelby, North Carolina. We don't have a doctor on every corner, so having a program here like Virtual Clinic helps our children to feel even safer at school. In order to educate children, they have to feel safe first. You have to have those basic needs met. They will tell you what's wrong with them. They are able to see the nurse immediately, and the nurse, if she needs to go further, the Virtual Clinic is right there.
My daughter has chronic asthma. Before this virtual clinic, about 3 to 4 times a week, I had to go pick her up, and it wasn't under control then. So now that we have the virtual clinic, I haven't went to go to the school to pick her up at all. It really helped me out and her.
It's really difficult if you're a working parent to make an appointment for a rash or a sore throat, and so we thought that perhaps we can help the families out, help our community out, help minimize ED utilization for things that really don't need the ED, that really just need access during working hours.
Usually I always go to the nurse and just take a breathing treatment. I take my asthma pump again after a couple minutes, and if that don't work, I have to go home. Now that I don't get out of school a lot, I get to take tests, get extra time, and now I'm making great grades.
Parents would pick them up last year, but now instead of having to pick them up, they're able to be seen by the nurse, be seen by a doctor virtually. In many cases, the children are able to actually stay, and with that, attendance is better, chronic illnesses much better managed. You have less ER visits.
One of the focus areas of Blue Cross Blue Shield of North Carolina is pediatric care. Now, we realize not everybody's got equal access to resources for medical care. Blue Cross Blue Shield of North Carolina is investing $750,000 over a 3-year time frame to the virtual clinic program. Actually helps ensure the children of Shelby, North Carolina are able to have good quality care regardless of their socioeconomic barriers they may have.
Maybe the child that night had an earache. Mom writes a little note to their teacher and says, could you please have my child evaluated in a virtual visit clinic? That child makes their way to the school nurse reaches out to our telepresenter. I or one of my pediatrician colleagues enter our virtual room. We auscultate the heart, the lungs. As we're talking to families, we say, oh, sure enough, that is a left-sided ear infection. Let me call some amoxicillin. You wanted it called into a particular pharmacy, so I'll go ahead and get that filled and send that over.
I'm very grateful for Blue Cross Blue Shield of North Carolina to invest in this virtual clinic. It really has benefited not only my daughter, but also is saving me time and money. So I'm grateful for the investment that they are investing in this virtual clinic.